Let's go now to an interview with Robin Smith, the chairman and CEO of NeoStem, a cell therapy company capitalizing on the paradigm shift that is occurring in medicine. In the future, cell therapy will play a significant role in the fight against chronic disease and in lessening the economic burden that these diseases pose to modern society. Now let's go to a follow-up interview with one of the hardest working and smartest CEOs I know, Robin Smith. I'm here with Robin Smith, the CEO of NeoStem, symbol NBS, on the New York Stock Exchange. Robin, thanks for visiting our studio today.
Thanks for having me.
Your company is one of the leading stem cell technologies in the world today. You're one of the leading thought leaders in the space. What does NeoStem do?
Well, NeoStem is a biotechnology company that's focused on developing novel therapies using stem cells, using cell therapies for treating chronic disease. We also have a multifaceted business in that we have a service business, which is contract manufacturing, that generates revenues and helps other companies to develop their cell therapy products.
Let's back up. What is stem cell? What is a stem cell?
So stem cells are in your body, they're in all of us, and they're our body's natural repair mechanism. There's different ways you can get stem cells, different tissues, and the idea is to take the best cells that are available and create a therapy to treat disease.
And you have a phase 2 clinical trial now that for a drug that treats heart damage.
Right, so we have a pipeline of cell therapies, but our most mature cell therapy is a way to use the stem cells of your own body, isolate out a certain cell type, deliver it back into the heart through the stent to lay down new blood vessels to prevent worsening of heart muscle function.
And you also have grants from the National Institutes of Health, from the Department of Defense. Talk to me about these grants and what you're doing.
So we have earlier therapies, a little earlier in development, and these therapies are funded through our grants that will help to do different things. So for example, our V-cell technology is focused at regenerating tissue. These are stem cells that can create different cells of different organs of the body, and we're looking to use these to repair wounds, to regrow bone, even to affect vision with macular degeneration, to create rods and cones for vision. So we believe these have regenerative properties and are looking to develop cell therapies using these V-cells, these cells of your own body.
So stem cell technology will change the paradigm. It will change everything we know and how we treat chronic disease in the future.
Absolutely. Instead of treating symptoms, we'll be looking to repair the underlying causes of the disease, and that's different. That's very different. There's a paradigm shift in medicine that harnesses our body's natural repair mechanism.
And you also have a book coming out.
We do. It's very exciting.
Tell us about that.
Yeah, you know, people don't really understand stem cells. They're confused. What's embryonic? What's adult stem cells? Is this today? Is it 3 years? Is it 10 years? And there's just a lot of confusion. So we felt it was very important to have people understand through stories, through real-life patients who have been treated in these clinical trials, and help understand how close we really are to making this mainstream medicine. And we were lucky enough to have a co-author in not only Max Gomez, but Monsignor Trafny of the Vatican, and the Pope behind this book, writing the foreword, to have people understand they don't have to choose between science and faith, that they support adult stem cell therapies and believe it's part of what will influence humanity and have a dramatic effect on our culture.
You're a public company. I'm sure our viewers today would like to know why they should consider investing in your stock today rather than a year or 2 years from now.
Well, you know, we're in the middle of developing these therapies, and there's starting to be a lot of data and a lot of excitement towards cell therapy as part of the future of medicine. So the stock is 60 cents, as you said. It's a good time, we believe, to get in and make an investment in the industry, and we think that we're very well positioned to be a leader in the space.
Well, I think you are too. Now, you know, these biotech stocks tend to move on news, and of course you want to be in the stock before news hits. I'll give you plenty of examples of biotechs trading 60, 70 cents, big piece of news hits, good data on a clinical trial, and the stock shoots up. So this clinical trial you're in now, you should have some data by the end of the year, correct?
We should have enrollment completed this year, and we expect that after the last patient is enrolled, 6 months later will be the first data readout. So we're progressing.
I'll note also that you are producing revenue. This is not a startup company. You're producing revenue through your contract manufacturing business. In fact, you did some work for Dendrion's cancer drug.
That's right. When Dendreon went through their clinical trial pathway, we were the lead contract manufacturer for their phase 3 and helped them get FDA approval for their product. And we believe contract manufacturing is a way to spread the cost over multiple clients and make this a much more cost-effective way of treating patients.
Robin, thanks for being with us today. We'll have you back soon.
Thanks for having me.
Now, I said last week, and I'll say it again, if NeoStem continues to grow its stem cell manufacturing business, and I believe it will, securing contracts with companies like Dendreon and grants from the National Institutes of Health and the Department of Defense, and their clinical trials continue to show promising results, and given the fact that the CEO will soon publish a book on stem cell therapy, further highlighting the achievements of NeoStem, then it's reasonable, very reasonable, to believe the stock will move northward, and it has been creeping up in recent days. Biotechs are all about news. They move on news, up on good news, down on bad news. I'm looking for more good news on NeoStem. Now's the time to position.